Hi, everybody, and welcome to Passing Naplex. I just wanted to take a few minutes and share with you some of the changes that have taken place or have been updated or regarding the Naplex exams. There has been 6 areas or 6 categories in how the exam has been divided. And so there's area 1, area 2, area 3, area 4, and area 5. Area 1 is about using the data that has been provided about the patient and using that to make an informed decision when making when choosing medication for the patient. For instance, if you need to look at the symptoms, like 1.5, you need to look at the signs and the symptoms of the patient, and then just look at the um, pathophysiology and maybe risk factors that are going to help you figure out what choice of medications to choose and which ones not to pick from. That is going to be 18% of the exams. We also have area 2, that is to identify the drug characteristics. That's 14% of the exam. And that is going to touch on the pharmacology. And then the other parts are going to be the black box warning. And also it's going to be on pregnancy and lactations. And area 3 is going to be about developing and managing treatment plans for the patient. Now this is where we figure out if patient comes into um, the community pharmacy and they're asking you for an over the counter, but the patient, who's maybe an infant, has potentially a you know has infection, which is increasing their temperature, which is at 103.5, for example. That is something that you cannot give an over-the-counter medication. You have to refer them uh, to um, to a doctor, maybe to the emergency room. And then also, this is going to be 35% of the exam. So things have changed a little bit. So before, the calculations carried a lot of weight, but now it looks like the managing of the treatment plans is carrying a lot of weight. In this area, we need to look at the therapeutic goals and the outcomes and the clinical endpoints. We also need to look at the drug dosing, the drug adjustments and drug durations. We also need to look at the drug route of administration, which is going to be huge. For instance, I know for sure, like one topic that, let me see, the ADHD topic, which has a lot of medications that are fashioned for younger children, that needs to be either sublingual or whichever formulation is going to be easier for the patient to take. And for example, Parkinson's disease and other seizure disorders, those ones also need to have medications that need to be administered quickly, when the patient needs them instantly. So like those are some of the topics that we need to know, how the dosage forms of that medication. And drug interactions is huge. There's the therapeutic monitoring parameters, like gentamicin. Do we look at the trough and do we look at the peak? And at what time are we supposed to be obtaining the labs? And we also have to look at the evidence-based practice and non-drug therapy and lifestyles that needs to be taken into consideration for a patient. For example, if a patient is coming in with prediabetes or pre-dyslipidemia, at that point we have to, or pre-hypertension, we have to look into modification of lifestyle before we start giving them medications. But if they have another comorbidity, obviously that is a factor that we need to look at, that is going to be categorized in area 1. So then we need to identify that we need to give them a medication. And so as we talked about, area 3 has 35% of the exam, which is quite a big heavy portion of it. We also have area 4 that has 14%. Now this is calculations. um, Calculations can go both ways depending on how well you've prepared for it. It can be an easy scoop, learning dosage conversions, rate of administrations, parenteral nutrition, biostatistics, pharmacokinetics, patient parameters, and laboratory falls in here, like the calcium I think it's calcium correction and also phenytoin correction also, like those ones are falling in here. And area 5 is about 11% of the exam. This is where we look at managed drug delivery systems. This is more about, I believe, compounding, knowing which medications are hazardous and which ones are not. And for the ones that are hazardous and non-hazardous, and we have to compound them, what are the circumstances that we need to ensure that are present in order for the drug to be sterile, and also to protect the person who's doing the product sterilization. So we need to look at all of those handling procedures, storages, and packages all at once, including the BUD, beyond use dates, and all of those. And there's also a lot of changes in that. And the last portion is area 6, which is 7% of the exam. And it's about the medication use system to ensure safety and quality. So all of this together comprise of the new board exam. So it's also changed in the amount of questions that we have this time. There's about 225 total of question compared to what we had in the prior in the previous exams, maybe last year, which was 250 questions. Out of those 225, I believe there's about 50 that are just for, just ensuring that the system is working well. I believe that's what they said. So just look into that. This exam is pretty much not hard as it seems. It's about mindset. It's how you study, it's how you understand the material, and it's how you apply the information you've learned so far. I just wanted to quickly provide you with, just a quick update that was presented to us in January 2021. Many people have done this board exam and they seem to be doing pretty well. And, I just wanted to be here to support you and encourage you, and also to help you get over your last hurdle for the board exams and be a practicing pharmacist. I will be making more videos in the future, so stay tuned for more. Please subscribe, leave a comment, and like, and just share it with somebody else who is available to, who's wanting to learn more about this new board exams. Thank you, and stay tuned for more information in the new videos coming in the future. Thank you. Bye bye.